There's £22 billion of public money spent in Greater Manchester annually. £22 billion. The public services in Greater Manchester actually have direct control over 16% of that funding. A city in Germany would normally control around 75% of that. So we don't have our hands on the levers that actually can deliver some of the economic and social changes that we need to make, and what it requires is a fundamental reshaping of the way we think about public service leadership. Yes, it's about more efficient and effective integrated health and social care systems, but it is fundamentally about making the conurbation more prosperous and reducing levels of dependence and increasing levels of resilience. There's an enormous piece of work that we've got to do. It's 22 separate work streams under 5 headings, and this year is just a build-up year. This year is actually to put in place all the infrastructure that allows us to deliver upon that £6 billion devolution conversation. At the heart of this is a strategic plan. At the heart of this is something that actually we all have to sign up to collectively that delivers on a clinical and financially sustainable system for the whole of Greater Manchester. But sitting underneath that requires a whole new way of thinking and doing things, but actually requires some very, very challenging conversations about how local government works with the NHS, about how commissioners work collectively together at different spatial scales, how providers work effectively together to deliver different outcomes. Culturally, we need to get to know each other better, and we have to trust each other, and we have to put our faith actually in executive structures, which means I need to actually give Sue something to do and actually be comfortable, but actually she's going to take my interests forward in a different way. By December, I've got all this right. That's an enormous piece of work. It requires us to do all that sort of work in terms of putting in place leadership, putting in place all the governance models, putting in place the sorts of infrastructure that allows us to effectively work together, because the next significant date on this timeline is of the 1st of April 2016. We'll be doing this for real, and all that needs to be put in place. Enormous amount of learning comes out of Healthier Together. One of the biggest pieces of public consultation that we've ever gone through in terms of changes to our health and social care system. Sitting in that document is the signatures of the 10 leaders of Greater Manchester who are backing up a consultation on hospital reform. When we first encountered this conversation, we found the NHS was talking to our local MPs, but they weren't talking to the leaders of the 10 councils, who are the political force that sits behind Greater Manchester. And my point was that actually you can talk to death to the MP for North Manchester about North Manchester Hospital, but if you're not talking to Sir Richard Leese, who's the leader of Manchester City Council, the chances are it's not going to happen.
The key was having the signatures of local authority leaders in our consultation saying that. I want my family to be taken past a hospital to a more distant hospital where a team works in a 24-hour way to cover things for these things that don't happen very often, because that's the safest thing. Yes, councils and the NHS talk different languages and they measure different figures in different ways, but there are very different cultures between CCGs and between councils. They do things in different ways. They have different levels of decision-making authority. Boards will allow or not allow their chief executive to make delegated decisions to different levels. So we've had to learn to work together. It was a pretty tight team that got us to the initial agreements, and that's great. But actually now to deliver, to create a system now in Greater Manchester requires a much wider, broader engagement and much more collective responsibility being held. So that's the much harder piece of work. There's a few things we had to get past very quickly, and the one that was key was it's our money. That's NHS money you're talking about here. Don't let them get their hands on it. Actually, every day in my surgery, more than half the people I see have social debt or housing problems, not medical problems. Actually, maybe there is a wider system picture here. So it's a conversation we had to get past. I've actually learned a lot in the last year about the similarities. So councils and CCGs, who we broadly represent here, we are membership organisations. We understand that there's people you need to bring along with you in a wider sense as you do things. And what I've learned actually, more importantly than anything, is that what Steve and I share is a strong sense of common values. We both get up in the morning because we want to do something for the population, but our system restrains us into managing harder and faster the current bits and only putting a little bit of innovation on the edges. What we are saying in Greater Manchester is we own that problem. We've got to sort that out. Now that's quite a big burden to take on. We are in this strong devolution position in Greater Manchester, I think, because we've shown ambition, but also we've importantly shown some competence so far in our experiences. But now we have to truly deliver as a system, and it's a really big ask, and it's a big piece of delivery to do. But it will also require support from our varied masters, because they can't manage us as individual organisations with individual conflicting targets. We're going to have to be managed as a system. I guess what I'd say is we want the system as a leader. So a collective leadership. We haven't done it all. We haven't got the answers, but that's what we think is the future direction.
Thank you.
Thank you.
Thank you.